So my name is Anis Farid, and I am a research project manager at Women's Aid Organization. We are an NGO based in Malaysia working to end gender-based violence and also promote gender equality. So our study is called Endemicity, Care and Gender, towards developing resilience in Malaysia's essential care workforce and infrastructure. So the idea behind this study is we were thinking about what it means to shift into an endemic phase post-pandemic, post-COVID. And we were wondering who gets left behind in recovery. Because a lot of times when we look at the decisions that are made to shift towards an endemic phase, a lot of these considerations are based on health indicators such as vaccination rates, booster rates, death rates. And there's obviously a gap because we know throughout the pandemic, women were disproportionately affected. And then in transition to recovery, if these issues from the pandemic were not fully addressed, that means that the gap for women grows. So we were interested in looking at the essential care workforce. So primarily people who are involved in healthcare, such as doctors, nurses, hospital workers as well, medical social workers. We were also interested in domestic workers. So people who are really at the front lines of the pandemic and how their ability to perform their unpaid care work was affected by the greater amount of paid care work that they had to perform during the pandemic. So what we are hoping to achieve as an outcome really is to take the experiences, understand the experiences of these women particularly who are involved in the essential care workforce and how that can feed into gender transformative policy responses and really building the resilience not only of the healthcare workers themselves, but also the infrastructure protecting the healthcare workers in Malaysia. With the Women Rise project, we were particularly interested in how it focused on the intersection of healthcare and women's work. Being a women's NGO in Malaysia, our primary focus has always been gender-based violence, and gender-based violence is a healthcare issue. So we are very familiar with women's health. And we've recently moved into economic empowerment of women in the past few years, especially within COVID, trying to better understand how women can be supported in recovery. So really the Women Rise call came at the perfect time based on our own priorities as well and what we want to shift towards. Additionally also, these areas are very understudied. Malaysia doesn't have a lot of data on how women were impacted by COVID. Especially frontline workers. So that gap really motivated us, that data gap really motivated us to apply for the proposal, just to better understand what the situation was on the ground for everyone.